Welcome to Arizona Bioscience Week. Welcome to the final day of Arizona Bioscience Week, and Voice of the Patient. So, patients are the reason that Arizona's bioscience industry exists. Patients are the reason that students go to medical school and nursing school and allied health professionals and all of the different things. Patients are why we as caregivers get up in the morning, sometimes very early. But we talk about patients all the time. We don't spend enough time listening to them. As the mother of now a man who at the age of 19 was diagnosed with Crohn's disease, I have seen that patient journey firsthand. When people and doctors did amazing things and when the system didn't work. So today we've asked some very special people to share their stories. Every patient's story is personal and every patient's story is valued. So we are going here today, patients, to learn from you. We are here to celebrate you, and hopefully, with what we learn, your journeys will get better. So with that, welcome to Voice of the Patient. My name is Joan Kerber-Walker, and I have the privilege of basically bringing everybody up and then having a little chat at the end with one of my very dear friends. Ladies and gentlemen, please welcome to the stage Barbie Engel.
I'm petite, so I don't even know if you can see me. Yeah. Good morning. I'm Barbie Engel, and back in 2002, I was on my way to work one morning, and I was in a parking lot waiting to park, and I saw this 15-passenger van coming up behind me, and I twisted between my steering wheel and the passenger seat and looked back and watched him run into me without stopping. He never saw my vehicle. Apparently it was petite too. And that 8 seconds of an accident changed my life. I thought I would be okay. They found me wandering in the building. I was the head coach at Washington State University, living my best life. And I was crying because I couldn't find the gym, and I was literally 5 feet from the gym. So I had hit my head in the car accident. They took me to the hospital. They said, you have whiplash and a concussion. You'll be fine in 3 or 4 days. And here I am. That was 2002. Now it's 2025. And from that day forward, I was searching to find answers and listening to every doctor. It took 42 providers and moving to Arizona from Washington State, losing my job to be able to be here today. I spent 7 years in a wheelchair and bedbound. And most people look at me and go, oh, she's totally healthy. She's beaten all these things. She's doing great. I still have challenges that I live with, but I found ways to get through, get to them and through them. And through that, I was overtreated, undertreated, and mistreated. Most people that look normal or healthy are not seen and not understood. And so I started first advocating for myself, and when I was able to start using the words, I would go into the doctor's office and just say, fix me, help me, I'm in severe pain, help me. And when I started learning the words to describe my pain, burning, shooting, bone pain, sometimes it feels like lightning's coming out of the sky and striking me anywhere in my body randomly. I'm sleeping 23 hours a day. It's very difficult to live a life. And when I started using those adjectives and actually describing, that's when a doctor finally looked at all of me and pieced together the different pieces. But in that process leading up to that moment and that time, I had my rib removed. That doctor made a mistake and messed up my lungs. So now I have a lung challenge. And he also, one of the bone spurs was hooked around my brachial plexus nerve bundle. So every time I would turn my head to the right, I would pass out. And these things continued and continued until that day where he said, I think I know what's wrong. And I was able to go home, study what he said. First time I advocated for myself instead of just jumping in and doing whatever the doctor said. I said, let me go home and research this, figured out what I needed to do. And then a week later went back to his office and had the procedure and got the diagnosis. Back then it was called reflex sympathetic dystrophy. Now it's called algoneurodystrophy. The original name for it was causalgia back in the Civil War. The name has changed over 20 times because it's a rare disease. And that was why it was so hard for medical providers to see all of me and not just treat my lungs, not just treat my shoulder, not just treat my knee, not just treat the burning pain. They had to see the whole of me to be able to treat me. And through that, I learned that I needed to have a team, and I needed to be an active part of that team. And I encourage other patients to go and become an active part of the team of people that you're working with, the nurses, the physical therapists, the doctors, the psychologists, psychiatrists, your pharmacist, everybody that's on the team. It's not going to be a magic pill that treats you and then you get back to life. It's going to be challenges that you face. You find the thing that works for that challenge and you move forward with that. And so it's been a multimodality approach that's actually helped me. But in 2007, I went into a medical conference similar to this. With all medical providers, and they said, you are a patient, you cannot speak to anybody, but you can sit in the room and listen. So I took the opportunity and sat in the room and listened, and when the professor was done, my husband got up and ran to the front of the room. I was in a wheelchair, still in the back, and he said, this is what my wife has, you just talked about this, we were here to learn about a different treatment, but you talked about this new treatment. What's coming down the pipeline? And we started realizing there's always new things coming down the pipeline. And we had to get activated to find those things. From there, he said, call me on Monday, call my office, I'll get you in, I'll treat you. And we said, okay. And we called on Monday and they said there's a 5-year waiting list for the treatment. And in the meantime, you have to stop all of your other treatments for this one to work. So for 9 months, I had no treatments. I thought I was going to die. I thought my husband would come home from work and find me dead from the excruciating pain and the other symptoms that I was experiencing. I went into the hospital 9 months later and in a wheelchair, and 7 days later, I was able to walk out. And you think, wow, I've gotten so much of my life back. And since then, I've learned whole genome sequencing is important. I've been through stem cell therapy. I have an oral orthotic device that I wear in my mouth to lower brainstem inflammation. There's not just one treatment. One treatment got me so far. And then when I started looking at and adding in other treatments, now I'm able to get up and live life and do more in different ways. It's not the same life that I had before, but it's a new way of living. And it's a way that taught me to share my story and to encourage other patients to share their stories so that we can be the best we can be in our daily life as well as in society. And through that, I've had many opportunities and experiences here in the state as well as federally. I've got to testify in front of the Department of Defense. I was the only civilian on the panel, and my mom was an Army colonel, so I knew how it ranked and I knew what was happening. But even the doctors were military doctors, and they could not talk to the general the way that I could talk to the general. So they were all deferring to me, and I was able to get 6 clinics opened in the United States for other veterans to be able to get the same treatments that I've been getting so that they could get back and live more life in a way that was more fulfilling for them. And many experiences like that over the years, but it literally taught me we have to be our own advocate We need to work as a team, and then we need to also lift up other patients, whether they have the same condition as you or a totally different condition. I now am the vice president of the International Pain Foundation. We work with over 166 different conditions, and there's over 10,000 rare diseases. And so I use my voice and encourage other people to use theirs, and I am encouraging all of you to be that cheerleader of hope for yourself and for others so that we can get the things that we need in society so that we can better our lives and better the world. So, thank you.
Ben and Dr. Ackerman, come on up.
Thanks for having us. It's a pleasure to be here.
Okay, yeah. Hello, I'm Ben.
I'm Lindsay Ackerman. Thanks so much for having us. It's a pleasure to be here.
Thank you.
So Ben's a patient of mine who's had psoriasis for many, many years, and I'd love for him to start off just by engaging you all in what it's like to live with this incredibly burdensome disease, and we'll talk about how we work together to get through it.
Right, so I guess my story starts back in college. That's when I was diagnosed with psoriasis. At the time, I didn't think much of it other than, oh, I'll take some creams. I think I went to like my regular doctor and they gave me some steroid creams, whatever. And then the battle started. Obviously, steroid creams didn't do much. I went through college with plaques all over my arms, all over my chest, all over my legs. At one point, I think it was about 75% of my body was covered in plaques. And not just little, a lot of people think psoriasis can be just these little marks on you. My plaques were very thick and very visible. So I couldn't go anywhere without being seen with this rash all over my entire body. So that was my life before I met Dr. Ackerman. So,
I will say Ben is an incredibly courageous and heroic person, having lived through what he's lived through and the changes that this disease can make, not just in a life, but truly to the trajectory of a life, are profound. You take a child, essentially, who's embarking on this transition point in life to move into adulthood and engage in the activities that a young adult should engage in, whether that's being able to concentrate in school and your directives therein, or engaging in social interactions or extracurricular activities. These diseases, and I feel very privileged in dermatology to have an opportunity to engage with patients in what I would consider a very experiential disease burden, continuum. We have diseases in dermatology that affect people in very meaningful ways. But I think Ben is incredibly courageous to share his story, but also what this disease had meant to you at that time in your life was substantial.
Yeah. I mean, it's hard to even explain it. I mean, in your 20s, you are obviously young and socializing, and I was a very outgoing social person up until high school, and everything just crashed. I was a shell of myself, and I still suffer from that today. I mean, even getting up here is kind of triggering for me because for 15 years, I spent my life trying to hide. I hid as much as I could, and that meant long sleeve shirts, pants, in the summers in Arizona. And after college, I started working. I was actually a hospitality restaurant management major in college, and immediately after college, I could not. I took one job as at a country club, and I couldn't hide my psoriasis enough to be working in the food industry anymore. So I completely changed careers after that. I moved back to Arizona, and it completely, like you said, changed the trajectory of my life for sure. But I'm just grateful for the medicines that I've been able to take. It's been a long fight. I think my wife and I counted yesterday 8 biologics I've been on with. And that's thanks to Dr. Ackerman always being able to find the next one that is going to work and not saying, well, 75% clearance is okay, because it wasn't because the 25% clearance was all over my arms and my face and my head, and it wasn't good. Yes, an insurance company might say it's good enough, it's working, but it wasn't. And I needed somebody to stand up and say, no, just because it's sort of working, that's good enough. And I took that as, in the beginning, as, okay, these medicines work kind of, and I'm just going to live my life like this. But when I met Dr. Ackerman, she's like, no, that's not good enough. We're going to find one that actually works and gets you to 100% clearance.
And this is just because, in medicine, we're treating anything but just a disease state. We're treating a person. And for Ben, any residual disease on his body was indeed triggering. I mean, it was, and rightfully so, apart from the fact that it was also in a visible area. So for him to go about his day and live his life and feel like he was able to contribute to society in the way he wanted to, participate in the activities with his kids the way he needed to not have psoriasis that remained in 25% of his body. And, I think when we think about innovation and we think about where the science has taken us, and in dermatology, I can speak very specifically, the past 15 years have been revolutionary, not just evolutionary, but revolutionary. We have taken, oral molecules that used to get us maybe 40% of where we are today and think that was like really great. And watching the revolution of where we've been able to bring patients now has been incredibly, incredibly rewarding. Why do we need the next best one? Because there's a guy like Ben who failed the former 8. There's always going to be somebody who is struggling to live that life that they need, and we rely on all of us together to continue that advocacy journey to make sure that we're moving the needle in science forward until every patient can live free of these disease burdens.
Right. And I mean, just to follow up on that, I still live every day. When I get a spot that will appear, it's usually close to when I need to do my next dose. My body will tell me when I'm time to take my next shot. I don't need a calendar, and that triggers a traumatic thing for me, being like, oh God, when is this one going to stop working? And let's hope there's another one that we have available after this one stops working, because it eventually will. And fortunately, there's already a couple more down the road that I think if this one stops working, I have a few more. So
I hope it doesn't stop working.
Right. So, that's kind of my story. It's really, a lot of people think like something like psoriasis is just, it's just on the face and it's just a rash. But I'm here to say it destroys people's lives. You just want to stay inside and hide, and you literally feel like you're a monster when you go outside. People are staring at you. They don't understand it. They think it's contagious. And you get sick of trying to explain what it is to people. So I just am grateful that I'm not in that place anymore, and really happy to have found these medicines that are just incredible, life-changing medicines.
Good morning. Thank you for inviting us here. I'm Dr. Jenny Beaver, and I am the president and CEO of Fourth Trimester Arizona. We're an organization that supports new parents, and I am honored to be able to welcome 2 of my board members today, Carolina Little and Dr. Alina Bowman, to talk about their experiences with postpartum mood and anxiety disorders. So my first question for the 2 of you is, can you tell us a little bit about your experience with perinatal mood and anxiety disorders?
I'm Dr. Alina Bowman. I'm a pediatrician in Tucson, and here today, though, to share my experience as a patient on the other side of things. So I practiced as a pediatrician for several years before I had my daughter, my first child, and I thought I knew what I was doing. I was very well prepared. I had her in 2021 in the peak of the pandemic, and I really struggled. We had a miscarriage prior to having her, so I already went into the pregnancy with a lot of anxiety, feeling like the shoe was going to drop at any moment. So when she was born, that anxiety overwhelmed my ability to enjoy motherhood. I wasn't sleeping. I was constantly stressed out about her dying or getting sick. I wouldn't allow people to visit us, wouldn't let people hold her. And I just thought that was normal. And I started becoming really irritable and lashed out at the people I loved, and finally realized something wasn't right. This isn't a normal, experience of parenthood, or at least it shouldn't be. And I went to my 6-week OB visit, because if any of you have a child here, you don't see a provider until 6 weeks postpartum, and just got a bunch of checklist questions. Are you having any pain? No. Are you having sex? No. And not really any questions about how are you doing mentally? How are you handling this huge transition to motherhood, changes that are happening physically and internally, and just yourself as a person. So I walked out of that visit just feeling totally unsupported for where I was in my life, and broke down. And thankfully, I had really good support through the people I worked with, because I am a pediatrician, so I was able to connect with a therapist in town and get help and support, and it completely changed my life. And I just look back at that and think, like, I'm a pediatrician. I work in this field. I of all people, like, I should be able to handle this or have the resources to navigate it, and I didn't. So if it was that hard for me, I can't even imagine how hard it is for some moms who don't have the knowledge or the resources or the support. And so shortly after is when I met Jenny, wanting to just do more and raise awareness. And so now I have 2 babies. My second baby, I had a much more wonderful experience with postpartum, and had the tools to have a really wonderful time with my sons. And now I serve as a board member on 4th trimester, and feel it's really important to come to things like these to share that awareness.
Hi. Sorry, I had to get over the hearing my voice over the... it's a thing, you guys. So my name is Carolina Little. I'm a marriage and family therapist. I've been in the field of mental health for the past 10 years. And I've been practicing psychotherapy for the past almost 6 years for children. And same as Alina, I was like, I'm going to have a baby. I know all the things. And I've been working with moms, and so it's like, I know the signs of postpartum depression. I'm on it. And you think you got this, and then it happens that you give birth, but nobody tells you that there could be things after birth that can rock your world. A nurse came into our room and said, I hate to be the bearer of bad news, I have to take him. And sorry. I wasn't expecting this. And took him away. And so I had an empty room. There wasn't a baby there. And everybody is coming in and going like, do you want pictures for your baby? Do you want this for your baby? And there's no baby. And then I was like, oh, okay, this sucks. And then finally they tell us, hey, actually you will be able to take your baby home with you. And so I was like, okay, great. And I'm like, I got this. We go home, and then these thoughts started to come, and they were aggressive. I wake up in the middle of the night, day 3, and it's like, you're not good enough of a mom. You should start looking for somebody to be your baby's mom. And I was like, okay, I haven't slept. It's okay. This is postpartum depression. I get it. And then I started to become obsessive over things that it didn't make sense, to the point that my husband, he goes like, I think I counted how much breast milk you have in the fridge. I think we can fill up like 6 gallons of milk. And I was like, yeah, I know. It's in case if something happens to me, you're going to be able to feed our baby. And he was like, that's not a normal thought. Something's off. And so I remember being in a meeting with my colleagues, and these are behavioral health specialists, and I mentioned to a colleague, I go like, I think I'm struggling with like some postpartum stuff. And we're now in the 3-month mark. And she goes, oh, I've heard that's rough. And she literally let it go, and I was like, okay, so who do I go now? My colleagues should know about this. And it was this moment where I was like, okay, what do I do next? And things started to escalate and escalate, the thoughts getting more intrusive and more aggressive to the point that I started to have a suicidal plan. And it was very scary. It was very defeating. And then finally, I had called places because also there's wait lists because there's not a lot of specialized mental health providers for mothers in postpartum. And I was in a wait list for 4 therapists. And finally, one called me back in August. My son was born in March. So the therapist calls me back and she goes like, hey, I can start seeing you. I arrive, I tell her what's going on, and she goes like, have you ever heard of postpartum OCD? And I was like, what do you mean? She goes like, it's not normal that you know where all the Chevron gas stations are in Phoenix. And I was like, no? She goes like, no. And so there's a huge misconception about postpartum disorders because the best way to describe them is that they're very sneaky and they are concealed under the idea that you're being just a very caring mother. And so they get very sneaky and you're just in silent suffering. And to this day, I know I've managed things and I work through of going like, it's okay if you don't pump gas in Chevron. You're not going to get in an accident, right? I have these routines that I have to like interrupt and work through. And it might look like that for the rest of my life. But as of now, there's a lot of things that have to be put in place to not fall into that rabbit hole of the disorder. But that's my journey.
Thank you both so much. Yeah. I don't think I'd even heard your stories to that extent, so thank you for that. One more question. What would you like people to know about supporting mothers in perinatal mood and anxiety disorders?
I just thought.
I think that there are a lot of things that we as a community can do to support moms to make the postpartum time easier. One of those being paid maternity leave. So part of my struggle, and many women, is my maternity leave, despite being a physician, was unpaid. And so my husband also, he works for himself, so we couldn't afford for him to take any time off. So I had no support at home with me when I was on my maternity leave. So I'm grateful that we at least could afford for me to take that unpaid leave, but I had nobody. And I work with moms and see their postpartum course all the time, and there's moms going back to work at 2 weeks because their work does not allow leave. And there's moms that have unpaid leave, and it really affects their mental health. Worrying about finances when you're also worrying about breastfeeding and your body healing and so many other factors it's just one small way we can support women in our country. The other part, as Carolina mentioned, is our lack of mental health care for women specifically, but postpartum women. I was very lucky to know somebody and get expedited care, but that's unique. And I think Carolina's experience is much more common, that we just lack providers. And a lot of those providers don't even take insurance because they don't get paid adequately through insurance. So not only are you, waiting a long time to see somebody, but you're waiting to see somebody that you're paying out of pocket for. So to me, those are two things I wish we could focus on and work to fix.
And to piggyback of that, the lack of information that is out there, birth happens every day thousands of births happen every day, and the fact that we fail parents and do not have a wraparound response for them to thrive is very insulting, and it's part of the human experience. Hearing the other speakers is that being in need is part of the human experience. And we are in a very ableist period in our country where we think that if you do the right things, nothing will happen to you. And we're all one step away from a bad turn, a person not paying attention or crossing the street or driving or anything like that, or just a birth away from your whole life turning upside down. And so the lack of information and the lack of understanding that need is human is really deterring and backtracking a lot of things. I think I went through, my whole master's program to become a therapist. And Alina also went through medical school and doing all this stuff. And postpartum is like graced over like 2 sentences. And that's very dangerous. And so we need to hype in and advocate for, hey, this is a very life-determining event, and we need to empower all service providers to be aware of it. I work with moms now to do treatment, infant loss, postpartum depression, and anxiety, and the lack of awareness that a child could die at birth or a mother can die at birth is so minimal, to the point that when a mother comes in with their child's birth certificate, people and professionals hold it as if it has the cooties. And they go like, oh, I don't know what to do with this. And so there's a lot of misinformation. There's a lot of lack of information at all. For some people, it's the first time that they hear that there's such a thing as postpartum OCD, that is not just depression. So starting there is the biggest thing, is to advocate that all types of agencies in field expand in this matter.
Thank you both so much.
Thank you.
Thank you. Good morning. Several months ago, I received a call from a former coworker and a dear friend, Alex Tesmer. He asked me if I could speak at the AZBio group on October 17th about my experience with breast cancer. Gosh, I thought, and even said to him, who would want to know about my experience? But he assured me that you would be interested. I do not think my experience is much different from anyone else's, but here we go. In July of 2019, I discovered 2 lumps in my right breast. At first, I thought it was my imagination, but working in marketing oncology with C.R. Bard, I knew it was something I should not ignore. After all, I read and heard about cancer every day in our business. But surely this was not cancer. It was probably just 2 little fat lumps, and now I would look like a fool going to have this checked out. I called my doctor at Mayo. They got me into their acute care. It's like an urgent care anywhere else. And I saw Martha, Dr. Whitehead's PA. She did an exam and sent me over immediately for a biopsy at the hospital. I told her, do not call me back for a visit and to tell me the results. Just call me. After all, it was just fat lumps, right? I was at home, sitting at my kitchen island, when my phone rang. My husband was out sweeping down the pool, and it was Martha. Happy, cheerful Martha. And she said with a gleeful voice, "Hi, BJ, it's Martha, and I just wanted to let you know that you have cancer." And then she went on with all kinds of supposedly important information on the next steps. I sat frozen, unable to think. After she finished, she asked if I had questions. No, I answered. I didn't know what to ask. 20 minutes later, Dr. Whitehead called, and she asked if I understood what Martha had told me. I said, I did not hear anything after the word cancer. She lovingly and calmly asked me to get a pen and paper, and then she told me the steps we would take. She told me how very sorry she was that this had happened to me. My husband came in the house, took one look at me, and asked what was wrong. And I said, I have cancer. He dropped everything in his hands and rushed to my side. Where I will tell you is where he stayed through my entire ordeal. Best husband ever. I had to go into the office the next week and tell my boss, Jennifer. She was the senior director of oncology marketing. She jumped up and came to me, giving me a big hug, and we both cried. Then she said, we are all here for you, and she was. Jennifer had a renowned breast cancer surgeon coming in from Dallas that day to work with the research and development team as well as the marketing teams on potential new products. Dr. Walton Taylor met me before he started his work with any of the teams. He sat quietly, listened to my fears, and then he reached over, taking my hands in his, and said, BJ, you are going to beat this. You are going to live to become a happy old lady. I will be with you every step of the way. He gave me his personal cell phone number, and he was there for me every step of the way. He gave me a list of questions to ask the doctor and then told me I had to text back the answers. I did, and he said, good, you're on the right path. Dr. Taylor called me throughout my treatment, and even after everything was over, to give me encouragement and support. He is an amazing man, and I am blessed to know him. Dr. Donald Northfelt at Mayo is a quiet, small, but brilliant man who speaks very softly and directly. He takes special care of each patient and is genuinely concerned for each one, determined to beat their cancer. I felt safe. A social worker, who apparently had been assigned to me, reached out. Bill and I attended classes to help learn what we should expect and need to do. They told me not to get my nails done, because if they clipped my cuticles, I could get an infection. So I told my nail lady, no sharp objects around my cuticles and no clipping. She complied. I got my nails done. They sent Bill and I up to the 3rd floor at Mayo Hospital, Building 3. That's the cancer building. I got off the elevator, and there was a lovely waiting room with big windows that overlooked the mountains of North Scottsdale, lovely soft shades of green decor, a happy place. However, no one looked happy. The room was filled with people sitting in semi-comfortable chairs, slumped down, looking sad, wearing soft, baggy clothes, dull scarves on their heads, sweatpants, and slippers. I stopped dead in my tracks, and I said to my husband, I'm not doing this. And my husband panicked and said, BJ, you have to do chemo. Oh, I'll do chemo, but this I will not do. And we continued our tour, and then we went home. I sat quietly and started my prayers. I told God I wanted to make a deal with him. You see, I knew I could not do this alone. I needed him. However, I promised that I would do everything I could to follow the doctor's orders, except for the nails. But he needed to take me the rest of the way. I promised to get up every single morning, shower, fix my hair when I had hair, and put on my makeup and put on my brightest colored tops and clothing all coordinated together, no matter how exhausted I felt. And trust me, there were days I did not think I could get out of bed, but I would not fail God in my promise. Bill would take me to the hospital for my appointments and chemo. I would head to each appointment with a smile and a positive attitude, quietly praying to God that he would get me through just one more day. The nurses and the staff were amazing and friendly. I loved them dearly because I knew this had to be an emotionally difficult job for them. How many people did they care for that did not make it? When I had my last chemo appointment, a group of nurses that had taken care of me came over with silly hats, big glasses, pom-pom shakers, and were cheering me on. I laughed so hard, thanking them for their loving kindness. I said, I guess I haven't been here on other people's last days because I haven't seen you do this. And they quietly said, because we only do it for specific patients. You always come in with a bright smile. You ask about our families, our children, us. You genuinely care about us as people. You put a bright spot on often very difficult days, and we want to thank you. You know, a smile is not a hard thing to give to people, and you never know how that smile will land on a person. You may just be what they need to lift their spirits. Please make a point of giving your smiles away. In November of 2019, I had surgery, a lumpectomy. I had considered a mastectomy, but when I talked it over with Dr. Taylor in Dallas, he encouraged me not to do it. In my case, it was not needed, and I would have to go through painful recovery on something that really wasn't needed. Dr. Northfelt agreed. I met Dr. Patricia Cronin, my surgeon at Mayo, and we scheduled a lumpectomy. Afterwards, she called me so excited, telling me that she was sure she got it all. I got off the phone and I prayed, thanking God for once again taking care of me. You see, he walked me through every step of the way. We were together. I kept my promise and all that I could, and he took me the rest of the way. In December of 2019, Dr. Northfelt told me with great joy that I was now cancer-free. He still made me go through the radiation, just to be sure, but we were on the home stretch. God gives us so many blessings, and we need to always remember that he is there guiding us. I would never have made it through without his guidance and his love. He put all the best people in my path and a caring husband to get me through. Today, I am now my husband's support team and caregiver. You see, within several months of my beating cancer, he was diagnosed with Parkinson's disease. In August of 2021, I retired, not because I wanted to leave my wonderful boss and my team, but because I had a more important job to do. I had to care for my sweet husband the way he has always cared for me. This is my life, and I am grateful for each day. Thank you for allowing me to share my story with you.
Sonia, come on up.
I'm also petite. but I don't know if I'm going to stay back here. So, does this work? Yeah. Okay. So, hi, good morning. I'm Sonia Vognot, and I'm honored to be here today. So, thank you, Joan, for inviting me. Before my diagnosis, I was also very, very sick. I caught every cold, every stomach virus, every infection that passed by. And most people would recover from these infections in just a few days. I just wouldn't. For me, a simple respiratory or intestinal infection would turn into a pneumonia, hospitalization, or could potentially even be death. I lived on antibiotics almost every day, and I was super sick. I didn't know it then, but I was living without much of a functioning immune system. Maybe some of you are familiar with what's called the bubble boy disease. David, who lived in a bubble, I've had the privilege of meeting his mother, Caroline Demerit, and a wonderful woman. I didn't meet David because he died from a severe combined immune deficiency. So I don't have the ability to make antibodies or fight even the most common germs. It wasn't until my late 20s that I finally learned why, after years of being called the sick one, or you just have a weak immune system, or you're hypochondriac. I was diagnosed with common variable immunodeficiency, which is not as severe as what David had, but it still significantly impacted my life. CVID is one of more than 500 primary immune deficiency diseases. In addition to that, I also was diagnosed a few years ago with a CTLA4 mutation. So I have both a compromised immune system. I can't protect myself against common germs, but I also have autoimmunity. So the CTLA4 is the gene, one of the genes that regulates your immune function. So my body simply couldn't defend itself, but at the same time, it has the ability to attack its own healthy, normal cells, so it's kind of a problem. The diagnosis for me changed everything, right? Because then I was no longer a hypochondriac. There was a real reason why I was getting sick all the time. And I could finally start finding answers. And there was a therapy. It's immune globulin replacement therapy. And I've been on it for the majority of my life. And I infuse medication subcutaneously every week under my skin to replace the antibodies that I don't produce. It's not a solution, but at least it helps me prevent the majority of the infections that are out there. And I infuse every week. And it changed my life. Each vial of the medicine is made from donated human plasma. There's thousands of plasma donations are pooled and purified to extract those antibody proteins, primarily IgGs, one of those antibodies that I lack. And it takes hundreds of plasma donations every year to keep a person like me alive. And coincidentally, this month is also Plasma Awareness Month. So I'm so happy to be here because I'm raising some awareness. So each infusion is more than a medicine for me. It's both the collaboration of science and the generosity of other people who donate. And they work hand in hand. So the other thing that's important to note is that the gamma globulin that's produced from the plasma donations is super expensive. Super expensive. And so it's through innovation that we are going to find new cures and therapies, but also through innovation and research, we have to make these therapies also affordable and accessible to other patients so that they don't miss the opportunity to be healthy and live a full life, like me today. I'm healthy, I'm active, and I'm super grateful. I can hike, I can travel, but my doctors don't like that, by the way, because a lot of other patients are not as lucky as me. They have not been diagnosed, or maybe it took too long to get a diagnosis, right? Because the longer you wait to get a diagnosis, more likely you're going to get more sick and you're going to have permanent organ damage, which will prevent you from living a healthy, productive life with a purpose. And I'm a wife, I'm a mother, and I'm also now a grandmother. And as probably some of you know, I live pretty adventurously. I take risks that most people probably don't, but that's what probably also keeps me healthy. And I live every day with gratitude. Every single day, I live with gratitude. So the gamma globulin infusions, again, let me remind you, changed my life. So there's over 500,000 people in the United States that live with a primary immunodeficiency. But yet there's thousands who still remain undiagnosed. And we want every patient diagnosed. We want everyone to live the best quality of life that they can possibly live. And that's why research and development is so important, and we need everybody's engagement. We need innovation in diagnosis to find patients sooner. It takes on average between 9 to 15 years to diagnose a primary immunodeficiency. And the test is so simple, to just measure your immune globulins, IgG, IgA, IgM, and to do vaccine antibody titers. It doesn't cost much. But most doctors don't do that because they've been trained that if they hear hoofs, it's a horse. But guess what? It could be a zebra, right? Also, some of us with rare diseases, we are zebras, and doctors should be more aware that there are zebras, not only horses. And so if we can identify the patients earlier, they can live a better life and a life with purpose. I'm also proud to serve on the Board of Trustees of the Immune Deficiency Foundation, or IDF, a national nonprofit that provides education, advocacy, and research support for peer connection, and for people and their families living with immunodeficiencies. The IDF is my extended family. It's part of my lifeline. It reminds us that when we have a support service, science, and community, we create a better future for everyone. So today, I want to leave you with the following. Learn. Learn about primary immunodeficiencies and other rare diseases, because awareness saves lives. So in my case, and others, think zebra. Care. Show empathy and compassion. Many immune conditions are invisible. I have an invisible illness. For years, or even today, it was like, oh, but you look so good. And guess what? You feel like shit sometimes. Right? But sometimes you still have to smile when people tell you, but you look good. And inside, you're really sick. So show empathy, show care. And now I got my notes all messed up. All right, give. Donate plasma if you can, because plasma donation literally sustains lives. Advocate, support research, innovation, and vaccination, and affordable care, access to care. With vaccination, that's super important, especially today. You know what's going on. But vaccination creates herd immunity. I don't produce antibodies. If you don't vaccinate and I get your illness, I can die. As simple as that. someone in your family can die. And so, work with your doctor. Some people legitimately cannot take vaccines. I can't take live vaccines. A live vaccine can kill me, but I depend on others to be healthy so I can stay healthy. And every week when I begin my infusion, I think about what it made it possible. The scientists, the doctors, and the plasma donors, and the researchers that are driving new discoveries. My life depends on all of them. And so does the future of every patient waiting for answers. Innovation saves lives. Compassion sustains them, and access makes them possible. So let's keep working together so every patient is found, every life is valued, and every person has the chance to live fully with strength, gratitude, and hope. Thank you.
Ladies and gentlemen, it is my great pleasure to introduce you to Representative Selena Bliss, who is, okay, you ready for this? She is a member of the Arizona House of Representatives. She is chairman of the Health and Human Services Committee, and she is co-chair of the Arizona Bioscience and Healthcare Caucus at the legislature. Please join me in welcoming Selena.
Thank you. Thank you, Joan. Appreciate that.
So when we look at health, it's such a huge thing, right? And before we get into all of those kinds of questions, I'd really like the audience to know a little bit about you and why you chose to serve and why the Health Committee in particular is so important to you.
Yeah, thank you. It's an honor to be here. I'm doubly blessed. I've been a nurse my whole career. I'm licensed 40 years now as of this year. I used my license to practice at the bedside for 37 years. While the last 27 of those years, I concurrently taught in a nursing program. So I can't help myself listening to the speakers. I made individual notes based on each and every one of you. So amazing, amazing stories. But I've known I was meant to serve in this position since I was 8 years old. My grandfather served in the South Dakota State House of Representatives for 17 years. Now that was back in the 70s and 80s, a little bit different times, a little different challenges, but he was chair of appropriations for most of that time. And growing up, I saw what he was able to do in that position to help others. The joke in the House was that he held the governor's wallet. So everything that went through spending and revenues as well went through my grandfather. So it's definitely a calling. You'll notice there are several different types of legislators. You'll quickly realize those that were asked to serve versus those that are called to serve. I see some of my colleagues who are asked to serve, they tend to maybe burn out a little quicker. They tend to not come back versus those that are called. Now, granted, I'm only 3 sessions under my belt. I'm in the middle of my second 2-year term, so ask me again in 2 years how I'm doing. We'll see. Thank you for asking, though.
So you just tell us what you need for support so that you do not burn out. We actually have this amazing new tool at AZBio called Lifespan Digital Health. I've got to show this to you. So it's a new program that's designed for residents and nurses to help with their mental health so they don't burn out.
You know, that's really important, and that was one of the themes I heard with the postpartum depression aspect, and that's that education and awareness, but it's also the theme of caring for the caregivers. And we have all types of caregivers, those professional paid caregivers, but look at some of these stories, the families Brad, you started this off with your story, and I was thinking of your parents because my brother suffers from bipolar disorder, and I saw the effect that had on my father, who just passed away last spring. But it really, really was hard on him because Dad was not a healthcare provider, but yet he suddenly was thrust into the court system. He had to be a volunteer lawyer for my brother, a healthcare provider, a social worker. He had to rise to the occasion, and I see that's what your parents did too. Looking at this, the very last story, it's amazing. The families, are we taking care of our families and support systems as well? So thank you for calling out that burnout in healthcare providers, both professional and even non-paid volunteers.
And, you know, when we talk about health innovation, everybody thinks about the drug developer or the device developer or the manufacturing company. But the reality is that those products and services are most likely going to be delivered at the hands of a healthcare professional, or at least the healthcare professional is going to determine the right one, and then we can administer them ourselves. But there is no single piece of that healthcare continuum that's not involved in supporting our patients. And so it's so important that we think about how we can help each person along that way. So, public policy. So you are, at the legislature, you make our laws, you fix our laws when our laws aren't quite right. Really, what is that process like?
Yeah, as a freshman, that was the first thing I realized coming into this position is we basically have 4 roles. If we, as a legislator, do nothing else, our primary job, our only job really is to create a budget. Arizona is a zero-based budget, so we have to come out to zero every year, no debt, and we tend to spend our excess, although we do have a rainy day fund. So while constitutionally we're down there to do the budget, we, by the way, sponsor and hear bills in our committees and on our respective chambers. I quickly realized we also have 2 other roles. We also oversee state agencies, boards, and commissions. In my case, as Chair of Health and Human Services, my counterpart on the Senate side, we both oversee 22 healthcare boards, and as well as state agencies. These come under review every 5 or 6 years or so. So it seems like every January, we're also reviewing our boards and our state agencies toward their metrics and whether or not they're meeting them. Every January, we hear about 5 or 6 hearings. So boards and commissions. And then the 4th role we have are constituent issues, where we hear from you. And we learn from you, what are your priorities? Joan, I have to say, and I share this with the voters, I believe what the state does at our level of government affects your daily life more than any other level of government. If you think about what the federal level's doing versus your county level versus your cities, maybe you live outside of a city, you're in an unincorporated area, so your county board of supervisors is your next level of government. Well, if you think about the laws we pass at the state, that's affecting you in your daily life more than anything. So that's the policy aspect. I want to share some bill ideas that I'm working on as we speak, where it affects the budget. And I believe that where we put our money where our mouths are. So what we budget is a determination of our policy. What do we hold important? Are we funding education, healthcare, programs that help keep people propped up and engaged in society? Is now a good time to share?
Absolutely.
All right. So what I've learned as a freshman legislator, which I'm not anymore, so I can shed that title, you really need to have stakeholder meetings to fine-tune your bills before you introduce them, because once you introduce them, they go live, and then the press is calling you, and your opponents are calling you. And if you make a mistake, now you have to run an amendment, and that's really difficult to do. We do it all the time, but I try to avoid it. So what I've learned by trial and error is to bring in those stakeholders. And what I heard loud and clear from the Multiple Sclerosis Society as well as the ALS Society is they're struggling with prior authorization of treatments as well as continuing authorization. So I'm holding 2 stakeholder meetings for 2 separate bills because I want to get them right. We already met with Dominic Braun from the Multiple Sclerosis Society. He represents New Mexico and Arizona. His is a reauth bill. If you're already diagnosed and you're getting treatment, why do you have to be rung through the ringer to continue these treatments? Also, when there's denials, we're looking at the time frame and the contact of how to address those denials, because we want to treat people and keep them healthy while they're dealing with their disease. The ALS Society, our meeting is in December, but I'm really excited to learn how we can better help the pre-auth. Now, if you think about it, I think right now Arizona pays for 65 and up, but some, in rare cases, young people in their 20s and 30s and 40s get a new diagnosis of ALS. Well, we already know the support they're going to need, the physical therapy, nutrition, respiratory therapy. Why are we making them delay their care through pre-auth when we already know what they need? So the ALS Society came to me and said, look, in Arizona, we could do better. And I said, tell me more. And that's how a bill becomes, it goes from an idea, a concept, to an actual bill. I'm looking at Barbie Engel over here. You came to us last year with a great idea on the red caps on opioid medications, where it's a violation of patient privacy when you go to pick up your prescription and the red cap indicates an opioid. Well, how private is that? In fact, now that I go to my pharmacist, I kind of look behind the counter for those red caps, and there they are. Point also being, you brought to our attention in committee when you testified that some, I guess for lack of a better word, kids would go to their neighbor's house and they would look for those red caps because apparently the street value was very significant. So through you bringing that to our attention, we were able to take that as a bill. Your representative at Walter Blackman from the Snowflake area brought that one in, and we had a stakeholder meeting, so we heard possible opposition, possible support, drafted that bill, had it heard right away in the Health and Human Services Committee, and that got signed off. So good job for you, yeah. I want to say that's the value of being in a chair. You asked earlier about being a chair of a committee. I'm in my happy place right now because as a healthcare provider, I'm in a unique position to speak the language that we speak. And I think being a nurse for so long, after 10 to 20 years, you start to forget that, oh, we need to be careful. The language we use sometimes can be insensitive or sterile to those that are not healthcare providers and those that are new in the system. You can't assume people know things. BJ, you kind of brought that up. The language we use can be a little harsh and the tone. So we have to remind ourselves to slow down and realize what it's like to hear that patient's perspective or the family's perspective. So back to being a chair, what I am as a chair as well as my colleagues is we are extension of the House leadership. So the Speaker of the House picks the chair. I was fortunate to be picked based on my skill set for Health and Human Services. I also served in that committee the prior 2 years, so it was not like it was foreign to me. So I do have an advantage on the provider side. However, I'm a little weak on the insurance side, and if you think about it, half of what we hear in our bills on the HHS committee are the payments, the budget, the insurance piece. So I'm always learning, but I'm also learning on the healthcare provider side what we could do better, and I realize we have a lot of work to do.
And, you know, I think back of where it was, it's so much better than it was. And, you know, we talk about prior auth and step therapy and all of those things where there were no guardrails to help patients. And Arizona actually has some of the best laws in the country around those things, and we're still looking to make them better.
Yeah, you bring up a good point. When someone brings up an idea for legislation to us, we'll commonly first ask, well, what are other states doing? We want to know, in these 50 labs of democracy, how other states manage their own unique situation. Maybe it's been tried in another state and it did work or it didn't work, and here's why. And then we can take it and say, okay, let's overlay that on the Arizona revised statutes, and our Constitution, to see if this is something that would fit for us. So we appreciate as legislators hearing, you're doing real well here. I get worried when I hear, but you're behind in this area. I was just, your flyer here on the closing the gap between cancer research and the cancer patient. We have other states that are doing better in pediatric cancer research. That's just been brought to my attention. So I'm working with stakeholders that go around the country and look at individual state laws. You'll see this a lot. In this case, it's raising funding and attention toward pediatric cancers. So I see myself as a facilitator. I see the good work the groups are doing. AZBio as an umbrella to bring in these people so that we can have these conversations. What can Arizona do better in the healthcare and healthcare sciences, and especially in research?
Yeah, and it's interesting. So you have been a champion for the Arizona Health Innovation Trust Fund now for a number of years, and we got some funding this last session for veterans, to do a special program for veterans. The challenges, and I know you get this and I do too, every group comes in and says, we need funding for this, we need funding for that, we need a special cancer fund, we need a special Alzheimer's fund, we need a special rare disease fund, and we are a net zero state. We do not budget that way. And so I think, the opportunity that we have to get creative with the structures we already have, like the Health Innovation Trust Fund, and figure out how we address some of these things within it, is a great opportunity for us going forward.
Yeah, this is a thin line we walk some days, is what to invest in. What I personally believe, and I think many of my colleagues do, is look for return on investment. For example, if we can keep certain populations healthy, we can actually reduce costs. If we can diagnose early and treat, we can reduce complications and long-term disability, and as well as quality of life. When someone lives quality of life, they can be a productive member of society. So we're constantly monitoring. I think it's smart spending, not so much having to, well, how can we raise money? If I spend $1 on AZBio, I can get this many more dollars back. So I think also what's important is when you're cutting a budget in a certain area, don't take the chainsaw, use the scalpel to be very precise. Yeah, sounds like you have some experience in this area. Now, heads up, caution with HR 1, the federal piece coming at us with the state Medicaid cuts. This is going to be top of mind coming at us fairly quickly. We've got Access is our state Medicaid program, and there's some significant projected cuts to healthcare with our SNAP benefits and work requirements. But Arizona, Maricopa County already has work requirements. We are a Medicaid expansion state, so we're going to feel the cut a little more than some of the non-expansion states. So we're already at work. There's a Rural Health Transformation Fund that are grant applications. It's one shot for funding over the next 5 years. It's due mid-November, so we're in a scurry right now to identify what we're doing here in Arizona or potentially could do to tap into those monies. I felt some validation when I saw the scoring system for certain projects, and I thought, oh, I've been running bills in these categories already. Things like scope of practice, allowing physician assistants to practice to the full scope of their training. Same with, been working with the Dental Association, the Nurses Association. I'm one of the past presidents, so I understand the importance of membership associations. I believe strongly in healthcare compacts. As a nurse, my license is good in other states that we share a compact with, but our advanced practice nurses, it's not that case. So I've sponsored last year a bill to bring us into a compact so you can have license portability and cross state lines. I've tried that with EMS. The fire union came out against me. Well, my husband's a retired firefighter. I'm like, wait a minute. You firefighters are telling me, you paramedics and EMTs, you want this for that license portability. So I'm getting mixed messages from their membership. So scope of practice, license portability, some areas in there kind of validated what I've been trying to do.
You mean that when you work in public service and politics, you get mixed messages?
Go figure.
So, okay, this is not a town hall, right? So Representative Bliss has great knowledge and experience around health at the legislature, okay? She is not a federal elected official, okay? And she is not responsible for what's going on in Washington, D.C. If you have, we have time for just a couple of questions. And, you know, we're happy to answer questions. And if you have questions on the federal side, I'm happy to answer those after we have questions for Representative Bliss. But again, focusing on the state. If you were talking to your legislator, which you're talking to the chair of the Health Committee, okay, do you have a question or something that you would like to share with her? Okay. What I'm going to do is I'm going to let you go first, and then I'm going to ask you to be my mic runner for other questions. Does that work? Come on up.
Yes. I'm happy to do that.
Thank you.
I had a really nice shirt on under this, but it's cold in here, so I'm wearing my sweatshirt. For those of you that don't know me, I'm Ashley Chambers. I'm Executive Director of Arizona Families for Vaccines. So we advocate for pro-immunization policy. Thanks. I was on this panel last year, and let me just say, all of y'all that were on the panel this year, amazing. You are incredible, and I was tearing up at everybody's story. So thank you for sharing. It's really impactful. My question is really attuned to everybody on this panel, and my question for Representative Bliss is, knowing how impactful patient stories are, but also I find it very difficult to bridge that gap between patient stories and the ability to come to the legislature on bills. We don't have remote call-in for testimony. So for those of you that don't know, when a bill goes through committee, you can go down to the Capitol, sign in to speak. But unlike some other states, you can't do it remotely. So for people who are immunocompromised, for people going through cancer treatment, for people with ALS, they can't get down to the Capitol to testify. Is there any possibility in the future of maybe changing the rules to make exceptions for people who, because of health reasons, can't get there? That's my question, and I thought it would be beneficial for everybody here to think about something like that.
Well, I always say if I was in charge, having said that, the relationships we build with our leadership is very important, and that's something I could bring back to leadership. During COVID, the lockdowns, that's how we did. I wasn't there yet, but I was watching, I was paying attention, and everything was done remote. So we know it can be done. We are a democracy. We want to hear from our constituents. But Ashley, you already also brought up a good point. When you hear a bill in committee, you're allowed typically 3 speakers for and 3 against, and then an unlimited amount of people can sit in the audience to show support. When we get a large crowd, we do overflow, so we don't like to let people out of that process. But when you pick those 3 strategic people to testify in committee, each only gets 2 minutes. But I quickly realized they have to be 3 unique viewpoints of that bill. The most important speaker is who puts a face to that bill. It's that person suffering from that disease, that that disorder or that injustice of our laws. So they quickly make it real, and I think that's the most important person. The other two typically tend to be someone that's like a lobbyist, or I'd like to call them legislative liaisons. It just sounds so much better. They can to answer the tough questions like, well, this is currently in Arizona revised statute, but this is what's missing, this is why we need this bill, etc. And then the third person, it can vary depending on the subject of the bill. So your involvement and engagement is extremely important to make it real. One thing we don't like to hear or think we're doing is promoting a bill that is for an individual or a vendor. We want to know we're helping a larger group and not a special interest group. So making it real, there you are.
Awesome, thank you.
Hi, I'm Jordan Burton. I'm at Lifespan Vision Ventures. We're a venture fund that invests in early stage biotech companies, and we're actually located outside of the state of Arizona. And so I heard all of these great programs that are available to investors within the state who invest in Arizona biotech companies. But I'm wondering, with the Health Innovation Fund, and as that starts to increase, how do outside investors invest alongside the Health Innovation Fund and advance biotech research as a whole? I think that's something that a lot of patients here really appreciate knowing about. Thank you.
I'm so glad that you asked that, because that gives Joan an opportunity to do a plug for the Health Innovation Trust Fund, if you haven't already were aware of that. So I appreciate that question.
So thank you, Jordan. So the Arizona Health Innovation Trust Fund is that pot of money that is going to be managed by the state, and then a 4% distribution will go to a nonprofit that will manage that process. And relative to specifically to investments, so the fund's mandate is to do three things: to develop our workforce in health innovation, to support the entrepreneurs, and then to do these mission-related investments so that they hit the milestones so that they start to get to a point where they are investable. So the way that the nonprofit will select which companies it invests in is it will go out to the venture capital community and the strategic, the companies that would help it, and say, okay, we're looking at these companies, you're a specialist in this area, so your fund, for instance, is very focused on longevity and neurodisease and things like that. So we would come to you and say, we'd like you to evaluate this, because quite frankly, Jordan's smarter than I am. And so, Jordan, I want you to evaluate this. I want you to score it for me. But the big question is if we can get them further along, would you consider investing in them in the future? And then you get to track their process. That's called syndicating the innovation, and that's a key component of how we'll work together.
Thank you.
Yeah, we're seeing this in other industries that we're bringing to Arizona, so we really want to champion this. We've got a handful of healthcare providers, Representative Willoughby, Senator Champ, that are part of this, Representative Travers, promoting AZBio. So we appreciate the expansion and awareness of what we have to offer here in Arizona.
Absolutely. And I think we have time for one more question. Anybody? I got one in the back.
Hi, I was just wondering, is there anything we can do as a community to help contribute to the application that's going in mid-November for the funding that you're looking for?
Yeah, short answer is to the state Medicaid program is Access. They have a portal on their website. They had a request for information. Now that was due 2 weeks ago Friday. So at this point, I personally would have to go back to their website to see what their next steps are. It's going to move quick. Also, you'll want to look up the application to see if what you're promoting or proposing is applicable as well. It's all out there. The application booklet is like 48 pages, but under CMS.
There is, so the governor's office made a call for that, and of course, CMS Access is under the governor's office. And there's information on the AZBio website. You can also reach out to me at jkw@azbio.org. That federal grant process is very time-bound. And so the state put their call out to stakeholders for input. That input is now going through a committee scoring process. They then have to give their recommendations back to the federal government, who has their guidelines and scoring process, and then we're all competing for these things. The challenge is right now, healthcare funding at the federal level is a bit of a moving target. And so because of that, everyone is trying to determine the best way to address that. And really, with this federal pot of money, we know that rural hospitals, rural communities, poorer communities are going to get hit a lot harder than, for instance, people that live in a very wealthy community. And so because of that, there's a lot of evaluation that has to go on. I know in conversation with our senators as well as with our members of the U.S. House of Representatives, that they are very aware. AZBio does a lot of work in gathering input from constituents and then routing it to the right person within the congressional offices, so that they have your feedback so that they can try and do what's best for all of us. And with that, I want to just end by saying, Selena, thank you.
Thank you. It's been an honor.
We appreciate you. And if you want to just stay there, I'm going to do the rest of the thank yous. Thank you to our patient speakers. You always amaze me with your fortitude, with your positivity, with your ability to, really go the distance. And equally important, your willingness to share some of your most private moments. That is not easy to do, and it's extremely generous. So thank you for doing that. To our audience, thank you for listening. To our AZBio members, thank you for being part of the tribe that is moving health innovation forward. And to all of our health innovators in the audience and watching, I hope you took really good notes. We have a lot of work to do. Thank you, everybody. Have a fabulous weekend. Bye-bye.
Because my car is going to get